The first task in this program is to help you learn about neutropenia, which is a low number of certain white blood cells. Neutropenia is a condition that may be caused by your cancer treatment. The more knowledge you have, the more prepared you will be to work with your doctor in helping to manage the condition and its effects. The chemotherapy your doctor has prescribed for you works to inhibit your cancerous cells from growing and spreading to other parts of your body. Unfortunately, some chemotherapy medications can't tell the difference between cancerous cells and healthy cells, so they may attack your healthy cells as well. The cells that may be affected include white blood cells called neutrophils, which work in your body to fight infections. The severity of neutropenia depends on how much your body's neutrophils are affected by the chemotherapy you are being given. This can impact the kinds of symptoms you experience. If you develop a fever when you have a low number of white blood cells, this is called febrile neutropenia. Febrile neutropenia is a serious side effect that occurs most often during the first cycle of chemotherapy, but can occur during any of your treatment cycles. When neutropenia occurs, it may last for several days. The fewer white blood cells you have, and the longer your white blood cell count stays low after a cycle of chemotherapy, the more risk you have for developing an infection. You may have a higher risk of developing a low white blood cell count and potentially serious infection if you are receiving strong chemotherapy, which slows down the production of white blood cells. You already have a low white blood cell count when you start chemotherapy. You have had previous chemotherapy or radiation therapy. You are age 65 or older. You have other medical conditions such as diabetes, cardiovascular disease, or COPD. You have open wounds or an existing infection, or you have cancer that has spread. This is sometimes called stage 3 or stage 4 cancer. One of the most common side effects of strong chemotherapy is a decreased number of white blood cells. Without enough white blood cells, you may be at risk for developing febrile neutropenia, which may lead to a serious infection. Some infections can require hospitalization and antibiotics given in the vein. So it's very important that you pay attention to any signs of infection and let your doctor know immediately if you experience any of them. These signs may include a fever of 100.5 degrees Fahrenheit or higher, chills or sweating, sore throat or cough, mouth ulcers or sores in the throat or around the rectum, vomiting that continues 12 hours after treatment, burning while urinating or an urgent need to urinate, unusual vaginal discharge or itching, redness, swelling, or sores on the skin, shortness of breath or chest pain, loose stools or diarrhea for longer than 24 hours, or blood in the urine or stool. It's important for you and your doctor to recognize any problems with your blood cell counts as early as possible and do what you can to help correct them. In the next chapter, you'll learn more about why your blood cell counts are so important.